I am Lee Rambo Kemp, First Vice President of the League of Women Voters of Orange County, and I'd like to thank and welcome everyone for coming out this morning, and would like to welcome our guests not only here in person, but those of us who are joining us live stream and online. Today's program will be available and is being live streamed as we speak. It will also be available later on our Facebook page and on our Hot Topics webpage. We hope you had a chance to view the music and videos we showed before the program. Those videos were produced by Grammy Award winner Aoife O'Donovan. Her album, All My Friends, was inspired by the passage of the 19th Amendment, which gave many women the right to vote over 100 years ago. This month, the League of Women Voters of Orange County is celebrating 85 years of defending democracy and empowering voters. And we are so happy that you are here to celebrate with us. A little known fact that I actually just discovered yesterday in looking at our favorite history book, Warriors for Democracy, is 50 years ago this month, today, the League of Women Voters took a huge leap and voted to admit to this exclusive club men. So we love you, we love all you guys. You can learn more about the history of the League in Orange County and find out about some other fascinating tidbits. I love this book. This book was produced and edited by our member Ann Patton, who's an incredible writer. And we have some copies available for sale today. We hope you'll take advantage of it. It is wonderful stories about women in Orange County and Florida and the difference we have made as a league since we started 85 years ago. Before we go on, let me remind everyone, if you have not already done so, to please silence your cell phones. Well, now, if you would join me, stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. It's now my pleasure to announce and acknowledge our sponsors. I'd like to start with our bronze sponsors, Lynn and David Berelsman, and the Voting Voices, which include Lori Wack, Michelle Levy, and Charlie Williams. Our visionary sponsor is Jennifer and Phil Anderson. If you are interested in becoming a sponsor, I'd love to have a chat with you today, or you can reach me at vp@lwvoc.org. I would like to ask our sponsors to stand to be acknowledged. We thank you. Before we ask our elected officials and candidates running for office to come to the podium, I'd like to share a little important piece of information about Winter Park. We have with us this morning Mayor Sheila DeCiccio, who, if you could stand, Sheila. Sheila has made Winter Park history by becoming the first female mayor of Winter Park. Our members are movers and shakers. Now I would like to invite all of our elected officials and anyone who is running for office to please come to the mic over to my left. If you would line up and introduce yourselves. We ask that you limit your remarks to your name and position or office you're running for, and ask that you do not, please, give speeches.
After that wonderful introduction, Lee, thank you so very much. Sheila DeCiccio, Mayor Winter Park, and welcome to our beautiful city. Thank you.
Good afternoon. I'm Geraldine Thompson. I represent West Orange County in the Florida Senate, District 15, and I'm a candidate for re-election.
Hello, everyone. I'm Tom Keene. I'm your newly elected representative from House District 35, representing Orange and Osceola County, and I, too, am a candidate for re-election.
Thank you. I hate to say this, but if you would please hold your applause until after everyone else has introduced themselves. Thank you.
I'm Ann Copenhaver. I'm running for re-election to seat number 4 on the Urban Orlando Community Development District, which I've been serving for the last 4 years. Thank you.
I'm Dan Helm. I'm a candidate for Supervisor of Elections for Orange County. I hope you all will join us next month when I'll be on the panel with some other fellow candidates.
Good afternoon. My name's Lisa Gong Guerrero, and I guess this is the first time I've ever said this, but I am a candidate for Orange County Judge in Group 11. Thank you.
Wow.
Good afternoon. I'm Karen Castor-Dental, and I am on the Orange County School Board, and I'm running for the Orange County Supervisor of Elections. Hi, I'm Melissa Vickers, and I'm running for Public Defender for Orange and Osceola County, which is the 9th Judicial Circuit. Thank you.
Hello, my name is Stephanie Vanos, and I am running for Orange County School Board, District 6.
Hi, good afternoon, everyone. I am Tanya Wilson. I am a circuit judge running for re-election in Group 37.
Good afternoon. My name is Alicia Payton. I am running for Circuit Court Judge in the 9th Judicial Circuit, Group number 15.
Good morning, members. My name is Andrew Bain. I'm the state attorney for the 9th Judicial Circuit, and I'm running to remain as your state attorney coming up in the next election. And I look forward to talking about keeping our community safe. Thank you.
Hello, everybody. Wes Hodge, candidate for Orange County Democratic candidate for Orange County Supervisor of Elections, and I am looking forward to joining you next month to talk about my favorite thing, voting.
Hello, I'm Marty Sullivan. I'm a commissioner for the city of Winter Park.
Hi, I'm Todd Weaver. I'm the vice mayor of Winter Park, and I'm not the first male to hold that position.
But he's one of the best males, right? Yeah, absolutely. Hi, everyone. Representative Ana Villascamani, thank you so much for being here. And welcome to our district. And of course, I am running for a final term in the state legislature. And I also want to really quickly just thank the legal voters for fulfilling this topic today. I worked at Planned Parenthood for about 7 years before I ran for office. And of course, this is one of the issues that is near and dear to my heart. And so I'm really grateful the League has championed access to abortion here in the state of Florida. So thanks for the hot topics, and let's go win. Thank you.
It's hard not to clap listening to so many great candidates and elected officials. We will move on to our program, Abortion in Florida, on the ballot and off limits. In 1916, Carrie Chapman Catt declared to a crowd of women suffragists, that it was time to turn the fight for the right to vote into a victory. The result? The 19th Amendment was passed. We, once again, are looking for a way to turn a crisis into a victory. For over 50 years, women have been able to make their own decisions about reproductive health care. Yet on May 1st, Florida's 6-week abortion ban went into effect. And today, we will explore how that ban is impacting Floridians, as well as those in neighboring states. And as in 1916, there is hope. We have an opportunity to turn a crisis into a victory because Amendment 4 is on the ballot. Our moderator today is well known to many of us, our co-president, Tiffany Hughes. Please give a very warm welcome to Tiffany.
Well, good morning, everyone. It's really great to see your beautiful faces another month. I am often at this podium, but I am seldom, if ever, moderating. So I'm excited about the opportunity to talk about a very necessary discussion today. Women's health and reproductive freedom is a fundamental right. That is close, please. And one that's certainly close to my heart as a woman, but also as a mom. Many of you have met my son, Legacy, and have interacted with him, or he picks up the phone calls in the car. But something I talk about far less is that the year before I had him, I had major surgery on my own uterus. And that means that I had very serious and difficult discussions with my doctors and my family about the risk and complications of having a child at all, and the options that I might need in the process. And to be clear, when my family had those discussions, I would not and did not include a politician. Florida politicians have put into law one of the most extreme abortion bans in the country, and today we are joined by panelists that lead in organizations that push the goal of reproductive freedom forward. So, without further ado, I'd like to introduce our panelists today. Taylor Aguilar is a statewide organizing director for Floridians Protecting Freedom, the coalition behind the amendment to limit government interference with abortion, which will appear on Florida's ballot as Amendment 4 this November. Taylor. Kate Thompson is the Senior Director of Public Affairs at Planned Parenthood of Southwest and Central Florida. They are also on the Executive Committee of Floridians Protecting Freedom. Kate has over a decade of experience in nonprofit and campaign leadership. Kate Thompson. Amy Weintraub is a Reproductive Rights Program Director at Progress Florida. She is a former chair of the League of Women Voters of Florida Reproductive Health and Justice team. She is also a leader with the statewide Floridians for Reproductive Freedom Coalition. And then we have Dr. Catherine Berryman, a board certified in obstetrics and gynecology, maternal fetal medicine, and obesity medicine. She specializes in complex pregnancy management and paternal genetic counseling and testing. Caring for women with high-risk pregnancies has given her passion to support reproductive rights and women's access to health. Our panelists, everyone. For the first part of the discussion this morning, I want to focus on where we are in Florida with the 6-week abortion ban and how patients are experiencing those changes. So for everyone, we have seen abortion bans enacted across the South and really across the country. What are the consequences of the extreme abortion ban like Florida's? Anyone?
I'll go first. Hi, everyone. So last year in 2023, abortion providers in Florida saw 84,000 patients in our state. The only state that provided more abortions than us in 2023 was the state of California. As of last week, we, of course, enacted a 6-week abortion ban here in the state. So that means that the closest access point, the closest place that you can obtain an abortion is in Charlotte, North Carolina. I did the math. I'm from Lakeland, a neighbor about an hour to the west of you all. From my town in Lakeland, it would be an 8-hour drive to get to the Planned Parenthood in North Carolina, Charlotte, North Carolina. So if you are someone from South Florida trying to get up to North Carolina, that's an even further distance to go. But realistically, North Carolina doesn't have the infrastructure to take our patients on. They have their own patient load, and they don't have the resources because they have a very hostile state legislature there too that's chipping away at access. So patients are realistically going as far away as DC, Chicago, Illinois, and New York State to receive their care. So as of last week, we've already seen abortion providers having to turn patients away to leave the state to receive care that they need.
Thank you so much. Anyone else? Dr. Behrman?
Yeah, I just wanted to jump in and say there's a reason why reproductive health care is a fundamental right. We know that having a legal abortion is actually a much safer thing for a woman than continuing a pregnancy to term. In fact, there's a 14-fold higher risk of major morbidity or death for women who continue a pregnancy all the way to the end. And so if we kind of think about those numbers, to see one maternal death from a legal abortion, we would have to look at 200,000 abortions. Whereas if we look at maternal deaths as a consequence of a pregnancy that goes to the end, there would be about 17 maternal deaths in 200,000 deliveries.
One of the things that I have found to be most effective when I'm talking about this issue of what are the real life consequences, right? That was the question, is to talk about real stories of things that have happened in places where these restrictions have been put in place. And we can talk about Ohio. Before their voters took control, we had a situation with a 10-year-old who was raped and had to travel to Illinois to get the abortion care that she needed. Or we can talk about Texas, where a woman was miscarrying. She was actively miscarrying and lost liters of blood and had to go on life support before it was finally deemed an emergency and she was able to get that care. But we have the situation here in Florida too. With the imposition of the 15-week ban a year ago, we had people like Annabelle Lopez of Hallandale Beach and Deborah Dorbert of Lakeland, who both had wanted pregnancies, both had very calamitous fetal conditions, and in Annabelle's case, she was able to travel out of state to get the care she needed, but Deborah was not, and she had to continue the pregnancy and give birth to a baby that lived 45 minutes. Her family had to endure months of that. So these are the stories that resonate with voters and that help them wake up to the need for Yes on 4.
Yeah, so much has been said by all of you. I'm honored to be on this panel. And at Planned Parenthood, as we were preparing for the 6-week ban with our providers, with our patient navigation team, one thing was very clear. We are all aware that this is an attack on healthcare. Abortion is healthcare. And at the end of the day, this is government influence trying to control and take power over our bodies and our ability to determine our lives. No exceptions are going to make it for those individuals, like Amy was speaking about, who need access to this care. Who am I to make that decision for any of you, and who is a politician to do that? Thank you for starting with that question, Tiffany.
Thank you. You're so welcome. Amy, I remember that Deborah Dorbert situation, like life situation, and reading about her in the hospital and having to carry that long, and that really breaks my heart. So wow. And Dr. Berryman, you actually led into our next question, which is for you. I saw an article that mentioned specifically maternal mortality, but maternal mortality rising in states with more strict abortion bans. They have the highest levels of maternal mortality than any other states. Can you talk about the importance of your relationship with your patients and what the 6-week ban does to that relationship?
Yeah, I think that's a great question. I really appreciate you asking that, because for me, as a healthcare provider, it's all about my relationship with my patients. The reasons why women seek abortions is so varied and complex, as varied as every single woman who walks through my office door. Typically, I'm only meeting them for the very first time when they're about 18 to 20 weeks pregnant, because that's when they're coming in for their anatomy ultrasound. And I'm often having to share devastating news with them about some of the findings on the ultrasound that are concerning. And then, together we struggle with trying to understand what exactly are we seeing? What is this birth defect or these constellation of birth defects? We wrestle with what are the risks of an unknown genetic abnormality compared with the risks of performing an amniocentesis to diagnose that genetic abnormality. We then discuss kind of the limitations on the quality of the baby's life or the child's life, and how limited we are in really being able to figure that out. And then my patients share with me some of their struggles and concerns with how am I going to take care of my other children? How is this baby going to affect my other children? And their financial struggles, and sometimes conflicts with their partners who may be on the same page, may not be on the same page. And so kind of taking all of those different things into account, we then kind of have, usually in a 30-minute appointment, have to make a decision about where to go from there and whether to proceed with the pregnancy or not. Politicians don't belong in the room with us. They just simply can't fathom how complex and how difficult these conversations are. And no law could possibly incorporate every single scenario that we see. So this ban really ties our hands, and we are not able to provide the medical care that our patients deserve.
Oh, thank you so much for that insight and perspective. Kate, you mentioned this just a little bit ago about Planned Parenthood and what the days and weeks leading up to the 6-week abortion ban look like. Can you tell us a little bit more about those final days, specifically in the health centers, for staff, for patients, once it went into effect?
Yeah, absolutely. And just quickly before I do, I can already tell how qualified Dr. Berryman is to talk about all of this and to treat her patients. And it just made me think, again, the policy makers, the elected officials, they are not qualified healthcare professionals. What are they doing in our healthcare? And that is a sentiment, of course, that rang through as we've been preparing for the 6-week ban. I have both the privilege and the obligation to represent our patients and our providers in this conversation today, and I want to share a story of one of our patients that we saw in the days leading up to the 6-week ban, Monday before it went off. Changing names for confidentiality, I'm going to tell you about Kayla. Kayla has had multiple pregnancies. She's got 2 beautiful babies at home, or 3, excuse me. And Kayla suffered with a not unique condition and certainly a concerning condition for anyone, and that's preeclampsia. And every time in each of her pregnancies, her preeclampsia came earlier and earlier, and when you have preeclampsia, you need to deliver earlier for your health and the health of your delivery. In this 4th pregnancy, Kayla made the hard and important decision that this was not a risk she wanted to put her family in. This was not a risk she wanted to be in. And so it was very important that at 8 weeks pregnant, she was able to get the care she needed and go home and take care of her family and be with them. And just 2 days later, Kayla would not have had that option. It's incredibly important that we not make assumptions. Preeclampsia can be life-threatening, but Kayla showed up knowing what her decision was before she had any symptoms. Would she fit eventually? How long would she have to carry her pregnancy if she would fit in that exception? These are real people with real lives, and that is what our healthcare team was seeing every day with the heavier burden that less than 24 hours after Kayla was seen, we would not be able to see Kayla or those like her again. The hardest day leading up to this ban in the month that we had to prepare for it was the day before. It was April 30th. Because not only do we have a 6-week ban in Florida, but we have a mandatory delay law. They tell women and people who come in needing care, you have to get this, or if you want to get this, you need to wait, you need to think about it more. No one comes in without thinking about it and talking to their doctor. So on April 30th, people at 15 weeks, 10 weeks, 6 weeks, 7 weeks could not be seen by us because we had to tell them they have to wait 24 hours in Florida. So even though they came in knowing that they had one more day left for their care, we couldn't help them. And that, for our teams that were on the call center getting those frantic calls, for the people sitting in those rooms with those patients breaking this horrible news, that was the hard reality in our health center.
Wow. Just a little story. I remember being in a health center and talking to one of our doctors and kind of going through the patient list one day. I remember being in a health center and sitting with the doctor and going through like the patients for that day. And we would see, for example, something like 40 patients.
And for those who don't know, Tiffany works with me at Planned Parenthood.
Sorry.
So we do this together.
So I've spent quite some time in the health center. But ultimately, the point of the story is the patient load of who would be able to be seen under a 6-week ban went from something like 40 to 6. So those are the conversations that are happening. Dr. Behrman, what were you advising your patients as of May 1st?
So based on the change in the law on May 1st, virtually every single woman in the state of Florida who wants to end her pregnancy has to travel out of state. And we mentioned North Carolina. I don't send patients to North Carolina because the waiting period is too long. So typically the closest place I've referred patients has been Virginia, but they also are not a super friendly state. And so I'm typically referring my patients to DC, Pittsburgh, New York City, and Chicago. And the cost of travel is prohibitive for a lot of people. And even if we are able to secure some funding to support them financially, then they still have to think about the logistics of childcare, of taking several days off of work, of recovering from their procedure. And all of these things mean significant barriers to care.
Thank you so much. You know, we've heard so much this morning about the tough road that women and pregnant people face and will face moving forward. But I would be remiss if I didn't also ask what we can do about that. You know, what do we need to do to ensure that anyone in need of abortion care knows their options, right, under this new abortion ban? So, Kate, this one's for you. What kind of help can women and pregnant people get if they have to travel outside of state, as Dr. Berryman mentioned?
Yeah, there are resources, right? We've had a year to plan for this. We are not the only state facing this. And at Planned Parenthood, independent health centers, and with many people at hospitals, we work together to figure out what is the best way we can ensure that our patients are still able to get the care. One of the ways is that we have a lot of patients who are still coming in to find out where they can go. They need gestational dating. Can they go to North Carolina? Do they need to go all the way up to New York? What are the steps and processes? And our commitment to patients is resources, information, time, and funds. We give them as much of that as possible. In the first 4 days after the ban, we had to navigate out of state 50 patients immediately. I mean, when you think about 84,000, and that's just part of the state, and that's just for Planned Parenthood. There's so many independent providers, doctors like Dr. Berryman, who are doing this same work, helping to navigate patients. And it is hard work, but there are abortion funds. Planned Parenthood helps with resources for those who need it, but we really work as hard as we can to make sure that they are supported in every step that they need it. but there are a lot of people who get scared when they learn that they need to go out of state. And so it can be really hard to ensure that people have access to that information. So it's really important to continue to share the fact that there are options. We can support people and help them along their way.
Appreciate that. Amy, I want to talk a little bit more about abortion funds, right? Dr. Behrman mentioned the waiting period in North Carolina is a bit longer, although it's closer. So we're asking patients or suggesting to patients that they go a little farther to a DC. How are the abortion, how are the abortion travel funds at like Florida Access Network being affected, being stretched by 50 plus women in one day needing to travel?
Yep, so we have about 6 abortion funds across the state, including Florida Access Network, which is headquartered here in Orlando. And they have done an amazing job making sure that people who otherwise wouldn't be able to afford the abortion care, whether it's the procedure or whether other costs associated with getting that care, have been able to get it. And they've been serving people locally, going to their own local providers. Well, obviously now, with the ban in place and people having to travel, their expenses have skyrocketed. They're buying plane tickets, they're buying bus tickets, they're paying for gas, they're paying for hotels, they're paying for childcare. So all of those things, the need has gone up so much. And even though they've networked with abortion funds in the other states where people are going to, again, the patient load being absorbed by these other funds, by these other states, cannot be overstated because the number of patients served by Florida providers and funds is so high. So actually, we're in the middle of the fundathon, the spring fundathon for abortion funds across the nation. Anything you donate to Florida Access Network right now for the next month will be matched by a national level donor. So it's a very, very awesome time to make Florida Access Network your charitable priority.
I just wanted to jump in and say one more thing. I think, the ban that happened on May 1st has really sort of pushed me to think about how I can help my patients at least control their future reproductive health. And so contraceptive counseling has always been something that's been an essential element of the care I provide to patients, but I think there is definitely a new sense of urgency, and whether my patients, are continuing their current pregnancy, or choosing to end their current pregnancy, I definitely emphasize more the discussion about contraception and really push my patients more to at least come up with their plan before they walk out of my office, as opposed to allowing them to just say, well, I'll think about it, you gave me the options, and I'll let you know later. Thanks.
That's such a good point, and sorry, Tiffany, to quickly jump in. That's one of the pieces that we've really been working hard at Planned Parenthood as well. How do we help more people and continue to expand access where we can? And so whether that is $9 birth control that we're now offering, as well as making sure they understand what their over-the-counter options are, or for example, I don't know how many of you know about LARCs, long-acting reversible contraception, but that can hurt. And it causes a lot of anxiety and stops a lot of people who struggle to take a pill a day or go in for their other options from getting an IUD. And so we're now looking at options and offering sedation options, offering opportunities to say, we hear you, women of Florida and women across the world who are saying, this is really hard to do, we don't like this, and making it accessible not only financially, but also in our hearts and in how we hold ourselves. I know it's something that was really scary for me, and so being able to offer that to people of reproductive age is really important.
What I'm hearing is we want to make sure that women and pregnant people have a plan and know their options. And speaking of options, Amy, we've heard a little bit about Plan C in the news. Can you give us a little bit more insight on Plan C and how it can help pregnant women, pregnant people?
Sure. More and more Americans, more and more Floridians are accessing abortion care by getting their pills, their abortion pills, through the mail, ordering them from out-of-state or even international providers. This can be done through telehealth visits with physicians in other states, or it can be done from online pharmacies and other types of vendors. Abortion pills have been FDA approved for more than 20 years for use by Americans. They also are safe and effective up to 12 weeks of pregnancy if instructions are followed. And so, literally hundreds of thousands, millions of people are using these pills successfully. Plan C, which was mentioned, is one organization that has an amazing website, a directory that offers lots of information about where these pills can be ordered safely and all the different types of places that are offering it. And that includes places like The MAP, which is, I think, the Massachusetts Access Project or something like that. Massachusetts has a shield law in place that providers there can never be extradited or prosecuted by Florida or any other state. They're protected by Massachusetts law. And those doctors are shipping drugs to Florida households every day. They are having a telehealth appointment and then sending the drugs out. By the way, abortion pills can be ordered in advance to keep in a medicine closet and a medicine cabinet just in case they are needed. So that information is also available at plancpills.org.
plancpills.org. I know this conversation feels a little heavy, and even I was talking with a friend about abortion access in our state, and truly heavy was the only word that came to mind. That between now and November and a little bit after, we would carry a heavy burden of lack of comprehensive reproductive care. But I hear there's options. I'm hearing that there's a light at the end of the tunnel. What I hear, and we'll talk a little bit more about that, Taylor, is come November, we'll be able to make our voices heard and send a clear message to our legislators that Floridians will protect our right to reproductive freedom. And right now, the only way to stop our 6-week abortion ban is Amendment 4. So Taylor, can you give us some background on the coalition and what has the League's involvement been in that?
Absolutely. So I want to do a little exercise. If you signed a petition to limit government interference with abortion, raise your hand.
Ooh, I love it, I love it, I love it.
Keep your hand up if you help friends, family, neighbors, community members sign a petition. That is why we're on the ballot today, right there, is because people didn't just sign their petition and pat themselves on the back and say, I did it, because we wouldn't have gotten the amount of petitions we got. It took everyday Floridians talking to their own networks about signing these petitions to help spread the word. So we submitted over 1 million signatures, 1.4 million signatures to the Department of State to be considered. Those petitions came from the Panhandle to the Keys. It came from Republicans. It came from NPAs. It came from Democrats. It came from young people. It came from old people. It truly is an issue that extends across party lines. It extends across demographics. It extends across age, too. And traditional wisdom maybe puts us in a box of partisanship, and that's just not true. That's not the reality. That's not the conversations we're having with voters out in the field. This amendment has brought back so much hope to people who have been doing the work for a really long time in the state, and we are so laser focused on making sure we're successful this November. The League of Women Voters across the state was a huge support. Out of our grassroots organizations, the League collected the most petitions out of any other grassroots organization. You all killed it. Not only did you help us get petitions, you helped us raise funds too, which is absolutely insurmountable when you were trying to run a statewide campaign. We are counting on you to continue to support us and continue to help us raise funds, continue to help us reach out to voters about Amendment 4 between now and November. And we just really appreciate the opportunity to be a part of your panel today.
Thank you for that, Taylor. And just to dive in a little bit more about what the League can do, what is the program going to look like to get out the vote on this nonpartisan topic? How can everyone who raised their hands and our friends and our coalition help to get out the vote? What does that look like?
We are running an all-gas, no-brakes campaign now through November 5th. We don't have the luxury of resting on our heels on this issue. We have 84,000 patients. We have a duty to win. So we have to be disciplined on our message. We have to be ready to call people out when they slip us into partisanship. We have to be those people that say, no, 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 that's not what this is about. These are about 84,000 patients. It is about providers who are put under threat, staff members that are having to contemplate if they're even going to have a job because of the 6-week abortion ban. There is so much on the line. We can't afford to sit this one out. I know we hear that every election, but this one, we really mean it. So we need you talking to your neighbors. We need you hosting house parties to help raise money for the campaign. We need you to, when you're out doing your tablings at the different community events this summer, make sure that you're carrying information on Yes on 4. And most immediately, May 18th, you can join us here in Orlando. Cheyenne is our lovely local host. Cheyenne is hosting a Super Saturday for Orlando, so there's a flyer on your table. We have a table out front on your way out. Please stop and talk to us. We're going to teach you about relational organizing and how to get the word out about Yes on 4.
You know, Taylor, I must admit, getting 60+% of Florida voters to approve a constitutional amendment is a heavy lift. We have a lot of work to do. And so when we think about the messaging, right, what is the very best messaging to convey to Floridians to get them to say yes to Amendment 4? What is Yes on 4 saying? What do you want us to communicate to our networks?
Yeah, at the end of the day, this is an amendment to limit government interference with abortion. Our message is we want to remove all politicians, regardless of their party affiliation, from our private medical decisions. So we are asking people to stay in that framework of limiting government interference with abortion. A lot of more conservative voters appreciate that framework as well, of keeping it there. Restoring Roe is not helpful. Fighting for our rights, while we like to talk about that, that's not necessarily something that resonates with voters, and it takes them to a different place in their mind. So we are keeping things in limiting government interference with abortion and making sure we stick with removing all politicians from our private medical decisions.
And I just want to add one thing to this that I think is so great about this program that Cheyenne is running and Taylor's helping to happen all over the state around relational organizing. The best message that works with the person that you're talking to is what they care about, what matters most to them. You know, these are values-based conversations. What do we each value? My brother and I, and my brother, who is a staunch Fox News supporter and listener and reader, he cares about his freedom, and so do I. And we align on that. And we both agree that we deserve the freedom to make decisions in our health care. And that is our honest answer with one another. It's not a nonpartisan issue. It's a freedom issue. It's a limiting government interference issue. And when you can have a genuine conversation with someone and really listen and find their values, you make that difference in bringing abortion into the conversation and helping someone who didn't realize how connected they are to this issue.
That was good. And Kate, I'm actually going to stay on this one. Thinking about those value-based conversations, and Dr. Behrman, I'd love your input here as well. Why should a woman, a pregnant person who is not of childbearing age, support Amendment 4?
Go for it. That's easy. So under this ban, we're denying basic health care to women, right? Our mothers, my mother, had better access to reproductive health care than I do now. So we need to pass Amendment 4 so that we can protect the rights for our daughters and our granddaughters. But it's not only about that, right? So reproductive health care is an essential basic component of health care. It's a safe medical procedure that's being denied. It's all but been eliminated in the southeastern United States. What's next? What other safe medical procedures or treatments are going to be denied to women next?
Wow.
I think my favorite way I've heard this discussed for anyone and why they would care about it. You know, we talked about freedom, we talked about values. There's an honest and vulnerable conversation, too, that my colleague Danielle brings up all the time, which is genuinely and truly, everyone loves someone who's had an abortion. 1 in 4 women have had an abortion. So finding those opportunities to be vulnerable and bring those to light and help people hear from individuals, that's why we all care, because we all want to fight for our collective freedom. We all want to fight for those that we know and we love, and that includes their access to health care.
And if I can jump in real quick, I'll just mention that I have heard, I have read, and I have seen that in states with these restrictions, currently having a shortage of specialists on women's health care because they've put this ban in place. We will have that here. It will be difficult to attract residents in our OBGYN residencies. I already know one of the premier doctors. We need we need gynecological care throughout our whole lives. You know, people still get cancer, cervical cancer, ovarian cancer. We are not going to have the specialists we need, particularly in rural counties in Florida, if these type of
So the Florida Medical Board did an analysis, actually, of physicians in the state of Florida, and this is several years ago. So this is before the 15-week ban and certainly before the ban that we're living under now. And for OBGYNs for the state of Florida, we were projected to have a 500 OBGYN shortage by 2030. That's before all of these restrictions. I'm currently one of the directors for the OBGYN residency program at my hospital, and I can tell you it definitely impacts our ability to not only recruit young physicians, but to retain young physicians. They are not wanting to come to Florida, and they are wanting to leave Florida. And so the 500 physician shortage is definitely now, I would say, an underestimation.
Wow, wow, wow. Which affects everyone, right? Young people, what I call our seasoned community. You know, everyone needs a doctor. Everyone needs an OBGYN to make sure that they're healthy, they're safe, that they have someone to speak with when something is right and when something is wrong. And we're seeing shortages of lots of different specialty areas across the state these days. Taking a step back to amendment for Taylor, this one's for you. When, not if, Amendment 4 passes, how will the coalition protect the intent of the voters from meddlement by, you know, the state legislature and the government, or that we're making sure that our judges can interpret the language as it was intended? You know, what is the coalition's plan for that?
Yeah, great question. So Floridians Protecting Freedom is a coalition effort. On our executive committee sits the ACLU of Florida and Planned Parenthood, who are the top legal and advocacy organizations in the nation. These are the brilliant minds who help us draft our language in the first place. These are the brilliant minds who defended us in the Florida Supreme Court so beautifully. I hope y'all got the chance to watch that. And this is also Planned Parenthood spends enormous resources in training and opportunities during session too, as well, to fight these abortion bans in the first place and these attacks from legislatures. So people told us before we ever got started that we would never make it this far. And if we ever listened to that fear of we might not make it, we would not be sitting here right now having this discussion. We can't allow the fear of what if get in the way of us winning this November. We have a badass team that is ready to put up whatever fight we have to do, but we have 84,000 patients, so we're ready to make sure that we have abortion legal in the state for even after this passes.
Great. All right now, Taylor, but we hear some grumblings. And this one's for Taylor, Kate, Amy. There have been some talks about the governor calling for a special session in September to add another amendment to the ballot. Can you tell us a little bit more about that?
Great news, it's not happening. So Governor DeSantis has now doubled down at least 3 times in public saying that he is not calling for a special session. So simply rumor at this point, so we aren't expecting that to happen. But again, if that does come up for us, we are prepared. We have an awesome legal and advocacy team that's ready to fight whatever battles we need to.
And we have run the polling. We know that more than 60% of Floridians, the majority, vast majority of Floridians want access to abortion care in this state. They do not want government interference. And so we are going to see confusing things coming from people who want to control our access to this care. So keep a deep breath with us. Keep in mind, they're going to continue to try to confuse us. We're going to have to fight hard against disinformation, confusion that they are going to try to sow, but we know loud and clear, right? We want to limit government interference in our healthcare decisions, and they can't take that away from us.
I love that. The framing, just limit government interference into our healthcare decisions. Simple. We are limiting government interference into our healthcare decisions. Can you say it with me? Limiting government interference into our healthcare decisions. Messaging, everyone, messaging. You know, we're really ramping down on our program, but I want to give all of our panelists a moment for some final thoughts. What do you want the league to know? What do you want Floridians to know about this ban and the amendment on the ballot in November and how it is affecting our patients today and what we can do about it?
Yeah, what I want you all to take away is that at the end of the day, these abortion bans are about power and control over our bodies. But at the end of that is our opportunity to take our power back. And that's what we're going to be doing for the rest of this year. We should not be letting a day pass by us that we are not talking to a neighbor, a cashier, our barber, our accountant about Yes on 4, because it's going to be on everybody's ballot this November. So Kate said it so eloquently, they are going to pull all the stops out this year, and we have to stand fast, and we know the support is on our side. Stay focused on our messaging, and stay focused on getting out there and getting out the vote.
You know, I want to bring one more patient experience that we had of the 50 that our team helped navigate out in the last few days. And again, I'm going to change a name for her confidentiality, but we'll call her Alice. And I think Alice's story is important because it is both unique and reminds us all of the incredible hurdles and obstacles we are putting in the way of Florida families right now. Alice is 8 weeks pregnant. Alice has the loving family of 6 children that she wants. She is so happy and full in her life, and she came looking for abortion care when she needed it, and we were not able to provide it. During her gestational dating, we found out that she's 8 weeks pregnant, and the place we can send her to is Virginia. What do you do with 6 children who are in school with a job when you need access to what is simple medical care? Luckily, and we've been working with her through it, she has been with her community, her family, her neighbors to figure out how to care for her family. We've been helping coach her along on how to talk to her job about needing to take time away to go travel for medical care. It is so complicated, and it is so unfair. And every day, there's a new person like Alice or like Kayla, who we talked to before, who needs access to this care. So on behalf of those 84,000 patients, many we have had the honor to care for, and from the providers who just want to care for their patients, and from our health center staff and call center who have to deal with the, and I hate to say it, but the crying, the screaming, the overwhelmed Floridians who just want health care. Thank you for being involved. We need your help to win Yes on 4. Every single one of those people, and those who don't realize they're going to be one of those people, needs your help now. So thank you.
Y'all, we are the League of Women Voters, and we know that for a woman, for ourselves, to experience the full, our full capacity as citizens and as being contributors in this democracy, that we need to be able to control our childbearing. And we in my generation and the generations before me since 1973 have benefited from having full access to reproductive health care. We've been able to control how many children we have, the spacing between them, and if we wanted to have them or not. And that is now going to be denied. You know, as the League of Women Voters, we have a unique position. We are uniquely positioned to have an impact on the Yes on 4 campaign. We have huge personal networks. We have power in our communities. We are considered a very valid resource for information that pertains to elections. We must each, as individuals, get behind this campaign. On your tables, there are flyers about the next Super Saturday. There's going to be one every single month between now and the election. Attend this. If you can't make it because you're on vacation, tune in to the virtual option. I'll actually be leading the virtual option in May, but Cheyenne, my colleague here, will be leading the Orlando one. You have choices. There also will be recordings. Don't miss any Super Saturday. The Orlando, you have 200 people here today. There should be 200 league members at this event on Orlando. If you care about Amendment 4, show up. You see those folks under the table? Look at what they have on. They have on Yes on 4 t-shirts. That is the kind of thing that we all need to be wearing every day. Or get your badge. Whatever it takes. Be out in the community. Be proud. Do not hold back. Let's get rid of stigma around abortion. Let's get the word out about Yes on 4.
I love that, Amy. You are such a motivator. I'm going to be there. I got graduations parties to go to that day, but I will be there in person. I just want to go back to Kate's story about Alice. You know, so many of my patients have similar stories, but Alice sounds like she is blessed with family and friends and resources. And as much as it's a huge challenge, a huge hurdle to be able to travel out of state to have her procedure, she's going to do it, right? She's going to make it. So many of our patients do not. And we are unable to provide equitable care. And it's, of course, this group of women that don't have the resources Alice has that carry the burden of this new law. Yeah. So we got to change that.
You know, Amy, you said something so beautiful, that the League, everyone in this room, our community is uniquely positioned to make an impact on Yes on 4. So as Taylor said, between now and November, everyone, it is all gas, no brakes. Right? We want to make sure that women and pregnant people have access to comprehensive reproductive health care, and that we are what? Limiting government interference into our health care decisions. We get to make those decisions for our health care. Us and our family get to make those decisions for our health care, not politicians in Tallahassee. So let's make sure that come November, that Tallahassee knows that our community knows that Floridians feel the impact of our voice at the ballot box, and that Yes on 4 passes. Can we get some claps for that? Now, I've been asking a lot of questions this morning, but I want to give the audience a moment for some questions. So we are out of time for this portion of the conversation, but you'll have the opportunity to ask those questions with Gina Hall at the mic to my left to facilitate a Q&A. You can start to line up right behind Gina.
All right, so here are the rules for today. If you want to ask a question, come get in line. We have about 10 minutes. One question per person, please, just to give everybody, as many people as we can, an opportunity. And this is my mic, so I'm going to hold on to it. You can give us your name. That would be great.
Hi, my name is Margie Varney. I know many of the people in this room, and I really have a comment. This was an amazing program. There are 200 voters in the room. There are 2 Supreme Court justices, Sasso and Francis, who are going to be on the ballot to be approved. They both did not support the amendment. And so vote yes for 4, vote no for these 2 Supreme Court justices.
Thanks, Margie, but these are questions. Okay, state your name, please.
Karen Ramberg, and I have a question about the use of medical abortion pills, which, thank God they're there, because they could help so many. And you did mention that the complications from those pills are very rare. But if there are complications here in Florida, what are the consequences for the patient and for the physicians who take care of them?
Well, I'd just like to mention that the abortion ban criminalizes doctors. It does not criminalize women who are pregnant. And Governor DeSantis has actually said he's not interested in criminalizing women. The ACA, the healthcare agency that oversees abortion providers and healthcare places, they have also come out with a statement that this bill does not criminalize women or pregnant people. So that is important to remember when people are using abortion pills, there's no law that says that people cannot take an abortion pill in the state of Florida. So I'm going to say that. I'll leave the healthcare impact to my colleague.
And thankfully, we have something called EMTALA. So by law, I am required to provide emergency care to any patient who walks through the door. It's as simple as that. So if they have a complication related to their medications that they obtained, they walk through the door and we will provide care.
Hi. So it seems to me that the lack of reproductive care for women affects husbands, brothers, fathers, sons, grandfathers. I'm wondering, is there any outreach planned to target men's groups specifically to vote yes for Amendment 4?
That's a great question. So we have to get 60% of the vote, and there's approximately half women when we look at the voter rolls. So men supporting Amendment 4 is huge. You do have an important voice in this fight. For so long, you guys have been excluded from this conversation, which has put a place of stigma around men and abortion, and we want to break down those barriers. So there is an amazing organization called Men for Choice, who they are a part of our coalition, and their whole mission is to turn men into pro-choice advocates. So they've been instrumental with petition collection and with our Get Out the Vote campaign. But they also were a huge part of our campaign launch, which just happened April 13th out here at Lake Eola Park. We had a man, Derek Cook, his wife is Anya Cook, who lost liters of blood and nearly bled out in a salon bathroom floor after being turned away while she was having a miscarriage. So Derek has stepped forward bravely as her partner and has been sharing his story and how that impacted him as his wife was about to lose her life over abortion bans that were in place. So men are absolutely affected by this issue. We do have outreach plans to include them, and we want you to be a part of this conversations. We need you to talk to other men about why this is so important and why they should vote yes.
Yeah, Taylor, you said it so well, and I want to underline your experience, your story as a man, and those men that you know matters so much, whether it's a partner, a sibling, a friend who has experienced a need for abortion care, or just why you want it to be available for your family or for your friends. Those are incredibly important people to influence others, like Taylor said. We need men having conversations with men and men having conversations with people of all genders about this and why they care, as we all will too.
Hi, Valerie Schultz, Seminole League. I've had people come up to me and say, well, this amendment is going to allow abortions right up to the time of birth. Can you please speak to, from the panel, what the actual facts are so that I have good talking points back about that?
Absolutely. So that is such a silly opposition talking point that comes up. That is simply not true. If you read our paragraph, which if you signed our petition, it was right there on your paper, this allows for abortion up until viability, which is determined by a healthcare provider. So our healthcare providers are able to determine when that viability point is, which simply means a fetus could survive outside of the womb. So abortion up until birth is simply a scare tactic and a talking point that's been used in every playbook that they've had an abortion ballot initiative. So we expected it and we're ready to combat it in that way.
Hi, I have a brief statement and a question. I practiced internal medicine my whole career, and we screened a lot of people for breast cancer genes and so forth. And a lot of those patients would not have embarked on pregnancies were it not for the ability to test embryos, because they didn't want to bring in children, even those who had lost babies, to Tay-Sachs and these other miserable conditions. I always told them in the end, it brings more life into the world that these people have this option, because they would otherwise not contemplate pregnancy. So that was my statement. My question is, where are we with the zygote issue here in Florida? Because I'm frightened about that. Are they safe? Can you do in vitro, all that stuff?
I'm not sure I entirely understand your question, but we are still able to test embryos prior to implantation, and the field of genetics has exploded in the last 10 years. So what we are able to test for has also exploded, and patients have the ability to make choice about which embryos they choose to transfer. Did that answer your question? I'm not aware of any limitations that are coming down the pipeline.
Okay, unfortunately, this is our last question. However, anybody that didn't get a chance to ask a question, hang around, and our panel will be available for a little while, and then afterwards. So, Christine?
Okay, this relates to our time between now and November. I think many of us hiked around the neighborhood, we showed up at events, we got petitions signed, we're still full of energy. My personal network knows about this, and I'd like to expand beyond that. How can we do that? Do we have handouts that we could use for canvassing? How can we reach those that we don't know personally?
Yeah, absolutely. So we are launching a new relational organizing app, which is part of the May 18th Super Saturday. But in addition to that, on our website, if you go to floridiansprotectingfreedom.com, there is a button that says Pledge to Vote. This is how we're able to stay in contact with people. So that's a way that you can help canvass those that you're out in the community, is helping them fill out these forms. When someone pledges to vote for us and they mark off that they want to vote by mail for Yes on 4, we have an automation set up to follow up with them to say, hey, did you know that you had to re-enroll and vote by mail this year? So we're having those conversations that we're not just raising our hand and saying, I'm going to vote on Yes on 4. We're making solid plans on how that's going to take place, whether it's early vote, vote by mail, or on election day. And of course, following up with resources as necessary, because there's been so many changes in voting law here in Florida. So I really encourage, we will have more physical printed materials that come along this summer. The League is one of our top partners. You will have access to that. But in the meantime, we do have an option on our website to help people get information and get plugged into the campaign.
Thank you. Gina, we do have 3 more minutes, the last 2, and I'll get
We have time for
Judge
one
Wells
more.
also.
Who's it going to be? Okay. All right. Judy's got a question.
Appreciate it. Thank you. Judy Hayes. I'm actually also the reviewer for this, so I'm going to meet with all of you afterwards to get some more information. But my question is, immediately after the ban went into effect on May 1, the legislature or the governor's cabinet immediately issued some guidance. So here we are once again, where they're trying to bat cleanup from having written a terrible law by explaining it. You know, they said that the treatment for an ectopic pregnancy does not necessarily constitute an abortion when we all know that it does. Does that provide for an avenue to attack the ban from a legal standpoint, and is anyone doing that?
Again, I think when you want to look at how the executive branch is being utilized to combat a ballot initiative, it's an extremely inappropriate use. Additionally, the pieces that they did try to clarify in there do not make the exceptions that are necessary for patients in order to receive care. The wonderful Representative Anna Escamani did a great job on Instagram if you want to go and see, because they utilized ACA to put out a don't listen to all of the misinformation of Yes on 4 fact sheet. And Anna did a great job going through and being like, actually, if you'd like a lesson in how to combat disinformation, redlining that entire paper. This is not the exceptions that are needed in order to access care, because there are no exceptions that cover all the needs to provide health care and quality health care and the health care patients need in Florida. How many more women need to come close to bleeding out in a salon after being turned away and worrying that she needed to get her hair done for when she was going to be at her funeral in the casket? That is not anyone else. No one else needs to be in that situation before Florida realizes, oh, maybe that should be defined as counting in this. We can't cover everyone. That is not an excuse for policy. Thank you for bringing it up, and that's why Yes on 4 is so important. They are not qualified to do this. Sorry, that one really heats me up.
Thank you. My name is Charlie Wells, and I served on the Florida Supreme Court for 15 years, ending in 2009, and I appreciate your presentation. I think that everyone ought to be aware, though, that the Florida Supreme Court has ruled as long ago as 1989 that the right to privacy in the Florida Constitution includes a right to abortion. And that, so I think that everyone needs to broadcast that during this season in which all of this is coming back up, that this issue, as far as Florida is concerned, has been decided by the highest court in Florida. Thank you.
What a beautiful way to end our Q&A, Judge Wells. Thank you so much. And now, as we come to a close, I'd like to say a thank you to our panelists. Taylor Aguilera, Kate Thompson, Amy Winthrop, Dr. Catherine Berriman. This has been a moving and urgent discussion. Amendment 4 is the future of women's reproductive health, and it is on the ballot. And while the League is nonpartisan, and also I just want to make an interjection, just want to let everyone know that the League is nonpartisan and we do not endorse candidates, but we do take positions on issues. And the League stands in support of Amendment 4. Now is the time. Now is our time to step up and get us over the 60% mark needed to pass Amendment 4, so let's get it done. Now, it would not be a League event without a call to action, and there's plenty of them. Amy mentioned the Fundathon for Florida Access Network and other abortions fund in the state. We ask that you be informed and get engaged, both in the League, in the Yes on 4 campaign, and in other issue-based organizations that are close to your heart. Phone bank with Floridians Protecting Freedom. Host a party, raise funds, raise awareness, talk to your now to November, everyone. Use the Yes on 4 campaign's new app called Reach, R-E-A-C-H. to build your own network of Yes on 4 support. And it is all of our fight. It is a Floridian fight. Our vote by mail registrations expired on 12/31/2022. And if anyone has not re-registered for a vote by mail ballot since then, please do so. Make sure to go on our Supervisor of Elections website and reapply if you want your vote by mail coming to your home this election cycle. There's quite a many things on your table. We have the Right to Clean Water petition, which will, we are starting to sign again for 2026. So I know that many of you would have signed it before. This is a new form. The old form would have been for the 2024 election. We did not get that on the ballot, and we want to make sure that it gets on the ballot and across the finish line in 2026. So please take a look at your tables and sign the clean water petitions and see a league member to turn that in, and we would get it to the appropriate place. Our AAP will begin organizing later this month for the August 20th primary, and that's Adopt the Precinct. If you are interested in becoming an Adopt the Precinct poll worker, please contact Mary Montanus. Mary, are you in here? Most people know Mary. See a league member. Mary will get you to the right place. We are particularly in need of bilingual Spanish-speaking volunteers. Each polling place has to have one to make sure that we accommodate our voters coming in the door. On your table, you also have gun violence prevention sign-up sheets. We have re-engaged our gun violence prevention committee, and we know that the folks in Washington also now have an Office of Gun Violence Prevention, and we want to make sure that we are doing our part to keep all of us safe. And then I have a bit of announcement. I know that our Rollins College students are not here today, but they play and we play such a pivotal role in supporting our students and their civic engagement. So I just want to give an announcement and a shout out and a congratulations to our Rollins College Democracy Project members who were awarded the Student Achievement Award last week. The awards recognize students who live in Rollins College mission of global citizenship and responsible leadership every day. Bianca Faloni, which is the DP student coordinator, was chosen as the Fiat Lux Award winner. Bobby Sina, who is the president of the Rollins College Democracy Project, received the Gateway Student Leader Award for active engagement on campus and helping his peers make a difference. And Stella Morris received the Community Service and Engagement Award, and she'll be next year's student coordinator. And she received that for exemplary leadership and dedication to community engagement. So while I know our students aren't here today, it is exam week for them, I still want to send them a resounding applause for their work and engagement on campus. As always, we want your feedback. Tell us what you thought of the program, how you like the food, the neighbors at your table, the event space. Click the QR code on our slide and on the handouts on your table, but truly, we want to hear from you. We want to make every month as exceptional as possible, and that is through hearing your feedback. Thank you, as always, to Cuisinaires and the Winter Park event team for the amazing food this afternoon. TJ in the back of X-Ray Studios for filming and editing our Hot Topics so that they're available on lwvoc.org and on our YouTube channel. And of course, we have Hot Topics Overtime, an extended discussion immediately following. Today, it's happening next door at the Winter Park Library, Edith Bush Theater, first floor, beginning at 1:15 until 2, moderated by our Ginger Mundy, who leads our reproductive women's rights committee. And then we have our June hot topic. We heard a little bit about this earlier in the program, but it will be our Supervisor of Elections Candidate Forum. which is very, very exciting. Elections are very important, and the person of whom leads our SEO's office is going to be decided by everyone in this room. So make sure that you get engaged. Some announcements. The Orlando District 5 Candidate Forum is happening tomorrow. I will also be moderating that discussion happening at Jones High School. I think I mentioned this at last Hot Topic. Of the approximately 25,000 registered voters in District 5, we are seeing turnout of something like 2,500. And so we want to make sure that we engage the members in District 5, the constituents in District 5, that they make their voice known in that election that's coming up. Voter registration is also happening at Orange County High Schools. You can visit our volunteer pages for that. The Orlando Yes on 4 Super Saturday is happening May 18th from 10 to 12. Learn how to move voters in your own network to action in support of Amendment 4. Cheyenne, raise your hand. We'll be leading some of that work. Using the campaign's new regional organizing app, Reach, and a Zoom session will also be available, as Amy mentioned. And then we will also have at Zion Hills Missionary Church. Voter services will be tabling on June 8th from 2 to 3. So we are trying to reach everyone, everywhere, to get out the vote, to register new voters, to make sure that we are re-registering for our vote by mail in preparation for our November elections. If you are not a member of the League, join us. We love having you. We love seeing you. We love having you engage in this work. And for everyone who is already a member of the League, please continue to engage, volunteer, donate, and bring a friend to an event. And if there are no further announcements, thank you for coming, and we are adjourned.